Na última sessão, a fisioterapeuta da Abigail topou falar um pouquinho sobre hipermobilidade. Então, só fazer essa introdução porque na hora eu não fiz. E eu vou deixar aí o vídeo em que ela explica o que é hipermobilidade. E vocês vão ver eu arrasando no meu inglês, só que não.
What's hypermobility?
So hypermobility simply is excess or more flexibility in someone's joints than there should be.
Okay. And there is a cause for the hypermobility?
So hypermobility can come from a syndrome, like for example, I feel like the most common is there's that, I can't say it, Ehlers-Danlos syndrome, or
yeah,
EDS,
I know,
yes,
I know.
Which is like a genetic condition. Also, like Down syndrome is considered, they have hypermobility most of the time, or you can strictly just have hypermobility.
I've heard that autism has a lot of hypermobility.
Yeah, sometimes they do too.
Okay. Babies and children are already more flexible
Yes.
than us. So how can we make difference between hypermobility or just...
I thought this was a great question, and so from my
I'm a great
end,
journalist.
I was like, that's what I thought when I saw this question. I thought, great question. So I was thinking, so children have more flexibility because their muscles are more flexible, right?
Okay.
Where true hypermobility is going to come in the joints themselves, right? So the knees will bend further back than they normally would, or their elbows. In Abigail's case, her ankles turn in more than they should, versus like a regular baby who just can like move their legs because their muscles themselves are flexible.
Okay,
Does that make sense?
Yeah, I think it is. It's different when, for example, a kid grab her feet and put on the mouth, and then when they turn the leg like Abigail does. Okay.
The difference between a muscle being flexible versus the joint.
Okay.
Are
we dancing?
Do you like
dancing?
I talk with my hands a lot.
Can hypermobility be delayed in motor development?
Yes. So our muscles are connected to our joints through connective tissue. So there's tissues in that joint, and then there's the same kind of connective tissue in the joints. So when those connective tissues are too flexible, like in hypermobility, a lot of times those signals don't get to the muscles as easily because that tissue is too flexible. There's kind of like a break in the circuit, if that makes sense. So a lot of times that will delay their muscle tone, and we call it low tone. Good job, Abby. That was really good. So that can delay their development because their muscle tone is lower and they're weaker as that'll go.
So it's good always be looking for that milestones, for example in CBC, and then if you see some wrong,
absolutely
go for
bring
help.
Bring it up at your doctor's appointment.
Yeah. So this is where we should go. The doctor first, the pediatrician.
Pediatrician, absolutely, because that's who makes the referrals to like me or to a specialist. So you go there, and then they hopefully will steer you in the right direction. Sometimes it takes a couple times to really,
because but they know, they should know. Okay. Because you know that I had an orthopedist let's look at her and say, she'll grow out of that. That was not nice. 6 months and her knee was totally to inside, but that's okay. Thank God we find you. Is the physical therapy the best treatment?
well, yeah.
Of course, we are the best.
No, I would say absolutely. Yes, physical therapy, occupational therapy. Occupational therapy deals more with fine motor, like grasping and buttons and those sorts of things.
Okay.
But like that's our specialty, is bones and muscles and joints and movement.
Okay.
Movement specialist. So yes.
Because the thing is to make this joint stronger.
Correct. So the goal is to get all the muscles around the joints to be strong and stabilize those. Stabilize those joints.
What the joint can do by herself, the muscles will help.
Exactly right.
Hypermobility can gets better with time.
Yes.
Just the kids will grow out of that.
Exactly. A lot of kids will. So the syndromes, sometimes they'll stay with them. So if they have Ehlers-Danlos or Down syndrome, they're going to have those syndromes. But a lot of times, as their strength and development grows, as they move more, they will get stronger.
Okay.
And it usually doesn't delay them, like they can participate in sports or whatever they want to do.
Okay.
But good job. Nice step.
Actually, she's walking just one hand.
Whoa.
Not too much, but
a little bit. Good
yeah,
job.
a little bit.
You're
She's
really
brave.
showing off.
She's brave. But sometimes you may need the treat for the rest of your
Sometimes,
life.
and sometimes kids will come in and out of therapy as they will injure themselves in a sport and they need a little bit more help getting back because of their hypermobility.
I see.
They need,
You know, it's fun.
Are you not excited to do therapy more?
And in case of orthosis like Abigail, it's a permanent thing or it can be just temporary?
It can be just temporary. End goal is that as her muscles get more developed, the muscles in her feet, the muscles in her legs, that her ankles will become in the right positions. Even up in her hips will help. So hopefully she'll grow out of them and won't need them forever.
Yes, the sign.
So with her, the one thing I really noticed with her whenever I first saw her is the way she sits, right? So she sits, we call it in a C position. So she would sit here, which is like and I can't even do it because I'm not flexible enough, but it's like a sign of low tone whenever they're in this C position because they don't have that muscle strength to get upright. So I feel like that's a big thing to look at. That, and a lot of times she does it now, you'll see it whenever they get bigger, is when they're standing, they then they lock their knees out, right? So that squatting's hard because you have to have a lot of strength to do that unlock and not fall. So a lot of times they'll just fall backwards, which is which is what we're working on.
And also I heard about the W sitting because she doesn't have strength enough.
Yes, it makes your base wider whenever you sit in a W, so you have more space and you don't have to control it as much. But we hound on the W sitting because it's a bad position for their knees.
But we are saying about signs that shows after 6 months, and before that we have something we can see.
Before that, a lot of times it is harder.
Maybe
delay. Delays, not lifting their heads. A lot of times early, hating tummy time because they don't have the strength to lift up their heads. That's not to say that every baby that hates tummy time has some sort of hypermobility.
But
So I feel like that's a big one.
And so keep seeing the pediatrician, keep seeing the signs, keep going to the physical therapy if it's necessary. But you may be released from physical therapy time to time.
Very, very well may be. And that's what is cool about early intervention, which she's in now, is really by that 3-year mark, getting caught up to those milestones will be so important for her later. These first 3 years are super important. Advocate for your kiddos. That's the most important thing. If you think something's wrong,
go after
That's
a great problem.